So I think one of the biggest things as someone who genuinely cares and as a psych major is that when people have certain feelings or they get in certain moods or they feel a certain way, we want them to know that it's okay to feel that way. A lot of people feel that way. If someone tells you you shouldn't, you should really consider talking to a friend, a family member, a professional. It's all okay. And I know that sometimes mental health issues or disorders are not taken seriously, but we want people to know that it's a big deal, even if it's just anxiety for like a day. Like, it's fine to talk about it. The biggest thing is accepting that it is there, and whether it's a huge issue or not, the most healthiest thing to do is to talk to somebody about it. The biggest way people feel better sometimes is to talk to someone and be able to relate to them. It wasn't until I talked to someone who was actually diagnosed with depression before that I found out I had mild symptoms of depression. So without me talking to them, I would have never known that I had mild symptoms, and to take control of them before they got into major symptoms. So the reason why we want to make this presentation is for people to know that it's okay to have issues. It's okay to have disorders. There's always someone there for you to talk to. There's always someone in the health center. There's a friend, there's a family. There's always someone that might be going what you're going through, and maybe they're too scared to talk about it. So even talking to them and bringing awareness to it might even help somebody else. But in general, we want people to know that it is okay. It is not seen, or it should not be seen as a weakness. It should be seen as a strength because you're accepting it. You are wanting to go forward. You want to fix it. You want to talk to someone about it. You are strong enough to handle the mental issues that you are going through. And in order to move forward, they need to be acknowledged, and people need to not be embarrassed to talk about them or even go and get help.